Hello, it's Dr. Rhonda Johnson. Today's Wednesday, February 16th, 2022, and today I'm talking about kids and COVID. Now remember, this pertains to today only. Things in COVID change very fast. Well, it turns out that January was a game changer in terms of COVID infections in kids. Over 3 million children were infected with Omicron in January alone. And it continues to infect children. According to the American Academy of Pediatrics, over 300,000 children tested positive last week, and that is believed to be a vast undercount. Now, we tend to think of COVID disease in kids as mild, but it's not true for all kids. Now, I want to briefly mention two studies published by the CDC. The first CDC study looked at COVID-19 related hospitalization rates among children and adolescents during the Omicron surge in January, and they found that hospitalization rates were 5 times higher than when Delta variant was dominant in September 2021, and the largest increase in hospitalization rates occurred among children 0 to 4 years of age. This study also found out that unvaccinated adolescents had 6 times higher hospitalization rates than fully vaccinated adolescents. Now, there was another CDC study that looked at hospitalizations among infants whose mothers were vaccinated and unvaccinated during pregnancy. And what this study found that about 84% of infants hospitalized for COVID and 88% of infants with COVID who had to be treated in the intensive care unit setting were born to unvaccinated mothers. Again, both studies emphasized the importance of vaccination in eligible children, adolescents, and pregnant women. And children, the data shows that children continue to be at high risk for COVID infection. Now, we know that COVID-19 affects mostly all organs of the body, and children's bodies are no exception to this. We still don't know if Omicron and Omicron subvariants infections will have lingering impacts on our children. We tend to think of COVID disease in kids as mild, but this is certainly not true for all children. So parents, my message to you is if you remain hesitant about the COVID-19 vaccines, please talk to your children's healthcare provider about your concerns about the COVID vaccine. You know, this is not over yet. So that's my message today. As always, my views are my own. Please stay safe and take care.